Arteriosclerosis, atherosclerosis. Arteriosclerosis and atherosclerosis are sometimes used to mean the same thing, but there's a difference between the two terms. Arteriosclerosis occurs when the blood vessels that carry oxygen and nutrients from your heart to the rest of your body, arteries, become thick and stiff, sometimes restricting blood flow to your organs and tissues. Healthy arteries are flexible and elastic, but over time, the walls in your arteries can harden, a condition commonly called hardening of the arteries. Atherosclerosis is a specific type of arteriosclerosis. Atherosclerosis is the buildup of fats, cholesterol, and other substances in and on your artery walls. This buildup is called plaque. The plaque can cause your arteries to narrow, blocking blood flow. The plaque can also burst, leading to a blood clot. Although atherosclerosis is often considered a heart problem, it can affect arteries anywhere in your body. Atherosclerosis can be treated. Healthy lifestyle habits can help prevent atherosclerosis. Symptoms: mild atherosclerosis usually doesn't have any symptoms. You usually won't have atherosclerosis symptoms until an artery is so narrowed or clogged that it can't supply enough blood to your organs and tissues. Sometimes a blood clot completely blocks blood flow, or even breaks apart and can trigger a heart attack or stroke. Symptoms of moderate to severe atherosclerosis depend on which arteries are affected. For example, if you have atherosclerosis in your heart arteries, you may have symptoms, such as chest pain or pressure, angina. If you have atherosclerosis in the arteries leading to your brain, you may have signs and symptoms such as sudden numbness or weakness in your arms or legs, difficulty speaking or slurred speech, temporary loss of vision in one eye, or drooping muscles in your face. These signal a transient ischemic attack, TIA, which, if left untreated, may progress to a stroke. If you have atherosclerosis in the arteries in your arms and legs, you may have signs or symptoms of peripheral artery disease, such as leg pain when walking, claudication, or decreased blood pressure in an affected limb. If you have atherosclerosis in the arteries leading to your kidneys, you develop high blood pressure or kidney failure. When to see a doctor: if you think you have atherosclerosis, talk to your doctor. Also pay attention to early symptoms of inadequate blood flow, such as chest pain, angina, leg pain, or numbness. Early diagnosis and treatment can stop atherosclerosis from worsening and prevent a heart attack, stroke, or another medical emergency. Causes: atherosclerosis is a slow, progressive disease that may begin as early as childhood. Although the exact cause is unknown, atherosclerosis may start with damage or injury to the inner layer of an artery. The damage may be caused by high blood pressure, high cholesterol, high triglycerides, a type of fat, lipid, in your blood, smoking and other sources of tobacco, insulin resistance, obesity, or diabetes, inflammation from an unknown cause or from diseases such as arthritis, lupus, psoriasis, or inflammatory bowel disease. Once the inner wall of an artery is damaged, blood cells and other substances often clump at the injury site and build up in the inner lining of the artery. Over time, fatty deposits, plaque, made of cholesterol and other cellular products also build up at the injury site and harden, narrowing your arteries. The organs and tissues connected to the blocked arteries then don't receive enough blood to function properly. Eventually, pieces of the fatty deposits may break off and enter your bloodstream. In addition, the smooth lining of the plaque may rupture, spilling cholesterol and other substances into your bloodstream. This may cause a blood clot, which can block the blood flow to a specific part of your body, such as occurs when blocked blood flow to your heart causes a heart attack. A blood clot can also travel to other parts of your body, blocking flow to another organ. Risk factors: hardening of the arteries occurs over time. Besides aging, factors that may increase your risk of atherosclerosis include high blood pressure, high cholesterol, high levels of C-reactive protein, CRP, a marker of inflammation, diabetes, obesity, sleep apnea, smoking and other tobacco use, a family history of early heart disease, lack of exercise and unhealthy diet problems. The complications of atherosclerosis depend on which arteries are blocked. For example, vascular disease. When atherosclerosis narrows blood vessels near your heart, you may develop coronary heart disease, which can cause chest pain, angina, heart disease, or heart failure. Carotid artery disease. When atherosclerosis narrows blood vessels close to your brain, you may have carotid artery disease, which can lead to ischemic stroke, TIA, or stroke. Vascular disease. When atherosclerosis narrows the arteries of your arms or legs, you may experience circulatory problems in your arms and legs called peripheral artery disease. This can make you less sensitive to heat and cold, increasing the risk of burns or frostbite. In rare cases, poor circulation of your arms or legs can cause muscle spasms. Aneurysms. Atherosclerosis can also cause aneurysms, a serious problem that can occur anywhere in your body. An aneurysm is a bulge in the wall of your artery. Most people with aneurysms have no symptoms. Pain and throbbing in the area of the aneurysm may also be a medical emergency. If an aneurysm ruptures, you may be exposed to life-threatening internal bleeding. While this is usually a quick and catastrophic event, slow leaks are possible. If a blood clot inside the aneurysm protrudes, it can block the artery somewhere in the distance. Chronic kidney disease. Atherosclerosis can cause the blood vessels that lead to your kidneys to shrink, preventing oxygen-rich blood from reaching it. Over time, this can affect the functioning of your kidneys, preventing waste from leaving your body. Prevention. The same healthy lifestyle changes recommended for treating vascular disease also help prevent it. These include quitting smoking, eating healthy food, exercise regularly, maintaining a healthy weight, checking and maintaining a healthy blood pressure monitor, and maintain healthy cholesterol and blood sugar levels. Just remember to make changes one step at a time, and keep in mind which lifestyle changes you can control over time. Diagnosis. Your doctor will do a physical exam and ask questions about your health and family history. You can be referred to a cardiologist. Your doctor may hear a whooshing, bruit sound as you listen to your arteries with a stethoscope. Depending on the results of the physical examination, your doctor may recommend one or more tests, including blood test. Your doctor will order a blood test to check your blood sugar and cholesterol levels. High blood sugar and cholesterol levels increase your risk of atherosclerosis. C-reactive protein, CRP tests can also be performed to look for a protein linked to inflammation of the arteries. Electrocardiogram, ECG or EKG. This simple and painless test records the electrical signals in your heart. Exercise testing. If your symptoms appear frequently during exercise, your doctor may recommend this test. You will travel by train or on a stationary bike while connected to an ECG. Because exercise makes your heart pump harder and faster than you do during most daily activities, exercise stress testing can reveal problems within your heart that can be missed in another way. If you are not able to exercise, you may be given a medicine that mimics the effect of exercise on your heart. Echocardiogram. This test uses sound waves to show how the blood is moving when your heart is also beating. It is sometimes combined with exercise stress tests. Doppler ultrasound. Your doctor may use a special ultrasound device, Doppler ultrasound, to measure your blood pressure in various places on your arms or leg. These measurements can help your doctor determine the degree of blockage of any blood flow in your arteries. Ankle brachial, AB, index. This test can mean that you have atherosclerosis in the arteries in your legs and feet. During an AB test, your doctor compares the blood pressure in your ankle to the blood pressure in your arm. An abnormal difference may be a sign of vascular disease, which is usually caused by atherosclerosis. Cardiac catheterization and angiogram. These tests can show if your blood vessels are narrowed or blocked. During this procedure, the doctor inserts a small, flexible tube into your bloodstream and into your heart. The dye flows through the pipe. As the dye fills your arteries, the veins appear on X-ray, revealing the blocked areas. Coronary calcium scanner. Also called heart scanning, this routine test uses computerized tomography, CT, imaging to create detailed images of your heart. It may indicate the insertion of calcium into the artery walls. Test results are provided as a school. When calcium is present, the higher the points, the greater the risk of heart disease. Another imaging test. Your doctor may also use magnetic resonance angiography, MRA, or positron emission tomography, PET, to study your arteries. These tests can show stiffness and narrowing of large arteries, as well as aneurysms. Treatment lifestyle changes, such as eating a healthy diet and exercising, are the first line of treatment for atherosclerosis, and it may be all that you need to treat atherosclerosis. But sometimes, medications or surgical procedures may be needed. Medications. Many different drugs are available to reduce, or even reverse, the effects of atherosclerosis. Here are some medications used to treat coronary heart disease. Statements and other cholesterol medications. Maliciously lowering your low lipoprotein, LDL, cholesterol, bad cholesterol, can reduce, stop, or reverse fat deposits in your arteries. Statements are often given to lower cholesterol, improve vascular health, and prevent atherosclerosis. There are many other types of cholesterol-lowering drugs. Another common type is a cholesterol absorption inhibitor called ezetimibe, Zetia. You may need more than one type of cholesterol medication. They reduce blood pressure. Your doctor may prescribe blood thinners, such as aspirin, to reduce the risk of platelet aggregation, build up a blood clot and cause further blockage. Blood thinners. Antihypertensive drugs do not help to reverse atherosclerosis but rather prevent or treat complications related to the disease. For example, certain blood pressure medications may help reduce the risk of a heart attack. Some medicines. Your doctor may prescribe additional medications to control health conditions that increase the risk of atherosclerosis, such as diabetes. Also, certain medications to treat the symptoms of atherosclerosis, such as leg pain during exercise, may be prescribed. Surgery or other procedures. Sometimes aggressive treatment is needed to treat atherosclerosis. If you have severe symptoms or restrictions, your doctor may recommend one of the following surgical procedures. Angioplasty placement and stiffness. This process, also called coronary percutaneous intervention, PCI, helps to open the blocked artery. Your doctor inserts a catheter into an infected vein. A second tube with a loose balloon at its tip is passed from the first catheter to the closure. Your doctor raises the balloon, stretching the vein. A mesh tube, stent, is usually left in the vein to help it open. Endarterectomy. In some cases, plaque formation should be surgically removed from the walls of the small artery. When a procedure is performed on the arteries in the neck, carotid arteries, it is called a carotid endarterectomy. Fibrinolytic treatment. If you have an artery blocked by a blood clot, your doctor may use a clot to remove it. Coronary artery bypass surgery. During this type of open heart surgery, your doctor takes a healthy blood vessel from another part of the body to create a passage around the blocked artery, redirecting blood flow. Sometimes skipping over is a fantasy. Lifestyles and home lifestyle changes can help prevent or slow the progression of atherosclerosis. Stop smoking. Smoking damages your blood vessels. Quitting smoking is the best thing you can do to keep your blood vessels healthy and prevent complications of atherosclerosis. Exercise several days a week. Regular exercise improves blood flow, lowers blood pressure, and reduces the risk of conditions that increase the risk of atherosclerosis and heart disease. Plan to exercise for at least 30 minutes most days of the week. If you can't put it all in one go, try breaking it down for 10 minutes. You can take the stairs instead of the elevator, walk around the block during your day, or do sit-ups or push-ups while watching television. Lose weight and maintain a healthy weight. If you are overweight, losing just a few pounds may reduce your risk of developing high blood pressure and high cholesterol, which are two of the most dangerous causes of developing atherosclerosis. Ask your doctor what your target weight should be. Eat a healthy diet. A healthy heart diet full of fruits, vegetables, and whole grains, and high in refined carbohydrates, sugars, saturated fats, and sodium, can help you control your weight, blood pressure, cholesterol, and blood sugar. Try replacing whole wheat bread with white bread. Take an apple, a banana, or a carrot and stick it as a meal. Read nutritional labels as a guide to controlling the amount of salt and fat you eat. Use monounsaturated fats, such as olive oil, and reduce or eliminate sugar and sugar. Manage stress. Reduce stress as much as possible. Practice healthy stress management techniques, such as muscle relaxation and deep breathing. If you have high cholesterol, high blood pressure, diabetes, or any other incurable disease, Work with your doctor to manage this condition and promote lifelong health. A different tree. It is thought that other foods and herbal supplements can help lower your cholesterol levels and high blood pressure, two risk factors for developing atherosclerosis. At the discretion of your doctor, you can consider the following supplements and products. Alpha-linolenic acid barley beta-sitosterol, found in supplements and other margarine, such as Promise Active, Blonde Psyllium, found in seed pods and products such as Metamucil, Calcium Ancestor Fish Oil Garlic Green Tea Oat Bran, found in oatmeal and whole oats. Citistanol, found in supplements and other margarine, such as Benical. Talk to your doctor before adding any of these or other ingredients to your treatment of atherosclerosis. Some supplements can interact with medications, creating side effects. You can practice relaxation techniques, such as yoga or deep breathing, to help you relax and reduce your stress level. These habits can temporarily lower your blood pressure, reducing your risk of atherosclerosis. Preparing for your appointment. If you think you may have atherosclerosis or are worried about having atherosclerosis because of a strong family history of heart disease, make an appointment with your doctor to check your cholesterol levels. Here is information that will help you prepare for your appointment and know what to expect from your doctor. What you can do. Know any pre-appointment restrictions. When making an appointment, ask if you need to do something in advance, such as cutting back on food. Many blood tests, including cholesterol and triglycerides, require you to abstain from food and drink for a number of hours before the test. Write down any symptoms you have. Atherosclerosis is a risk factor for heart disease. Always tell your doctor if you have symptoms such as chest pain or shortness of breath. Such information helps your doctor determine how to treat your atherosclerosis. Write down key details, including a family history of high cholesterol, heart disease, stroke, high blood pressure, or diabetes, and any major stressors or recent health changes. Make a list of all the medications, vitamins, or supplements you take. Go with a family member or friend, if possible. Your traveling companion may remember something that you missed. Be prepared to talk about your diet and exercise habits. If you have not eaten a healthy diet or exercised, your doctor can give you tips on how to get started. Write down the questions you will ask your doctor. Preparing a questionnaire will help you to make the most of your time with your doctor. With atherosclerosis, some basic questions to ask your doctor include: what tests will I need? What is the best treatment? What foods should I eat or avoid? What is the appropriate level of exercise? How often do I need a cholesterol test? What are some of the key therapies you suggest? I have other health conditions. How can I treat them better together? Are there limits I need to follow? Should I see a qualified physician? Is there an alternative to prescription drugs? Are there any brochures or other printed material that I can take with me? Which websites do you recommend? Do not hesitate to ask any questions you may have. What to expect from your doctor. Your doctor may ask you many questions, including: do you have a family history of high cholesterol, high blood pressure, or heart disease? How are your eating and exercise habits? Do you smoke or smoke in any way? Do you have discomfort in your chest or pain in your legs when walking or resting? Have you ever had a stroke or unexplained numbness, itching, or weakness in one part of your body, or difficulty speaking? What you can do right now. It is never too early to make changes in your lifestyle, such as quitting smoking, eating a healthy diet, and exercising too much. These are simple ways to protect yourself from atherosclerosis and its complications, including heart attack and stroke.